So in addition to your role in the NHS, you're also a co-founder and
Mhm.
clinical director of London Scar Therapy. Can you talk about the story behind starting this?
Yeah, of course. It was about a year ago that we opened our doors, but it took about 6 months before that, probably longer than we anticipated, to jump through the loops and the hurdles of starting up our clinic, and a lot of blood, sweat, and probably a few tears here and there. And it was quite a serendipitous moment where I met up with my colleague Daniel Che, who is also a colleague scar therapist of mine and hand therapist. We work together quite well. And we talked about access to scar therapy in the NHS and also awareness of scar therapy in the NHS. And while we find that as our work is growing, public and private, the awareness is increasing as to what we do. I've done a few conference presentations, a few talks, etc. And it's relatively difficult to refer to us in the NHS. I think as the NHS is, lots of services are governed by wait lists, and there's quite a lot of loops to jump through to access our service because of how small it is, right? And pragmatically also about funding, right? Like our skull clinic is run by plastics pretty
Mhm.
much, and that's how the funding comes through. So in the NHS, the patient have to be on the plastic surgery to actually access us. And so any orthopedics patients, well, they wouldn't immediately be able to see us through the NHS. They'd have to go through a plastics consultant to then see us. And so we found that the timeline from initial referral to us is relatively quick at times, but from when they had their surgery or from when the excessive scar was noted or picked up, the timeline to referral was quite long.
Mm.
And it's challenging because, like I said, you've got that 2 year window, and the sooner the better, right? Like if you've got an excessive scar, be proactive about it if you can. And when I see us have a new scar that existed, why has no one told me about this before?
Mm.
Even post-op, I saw some nurses, and they told me about kind of the dressings and some scar massage, but I didn't really know about the rest of things. And again, I think that forms part of kind of awareness and knowledge. There's a
Yeah.
few gaps as to what scar management does, what the effect and the power of it is. And so this clinic that we formed, we put the website up, and amazingly, we got a few calls like the next day or the day after. And I was like, wow, people are actually seeking us out.
Mm.
So obviously we're in the right area and the right space to affect some change. And to this day, we've got pretty much a day a week that we work in our private clinic in addition to our NHS practice. We have to make sure we navigate the waters of making sure that we don't have any conflict of interest as therapists within the NHS and private practice. So we're always very careful with that. So we're not mixing or merging the two, because often we use very similar suppliers to the NHS, such as our garments or our silicones.
Mm.
And so it's very clear, again, to manage their expectations, that the fact that, we're working with the NHS shouldn't impact or sway anything that we do privately, right? Same for patients, right? So if we say that, this is scar management, the patient's like, oh, I really want to have a bit more of this. I was like, because I'm seeing you here, I can't see you in private sector, but I can find a few colleagues that potentially are working in the same area. And that's where I use like public registers, etc. And so as part of our clinic, we do very similar interventions to the NHS, but the frequency and the length, the duration of sessions is increased. We also offer the skin camouflage that I was talking about with the paramedical makeups in that clinic. And we've been fortunate enough to win a few awards. So we've won the Best Emerging PT/OT Clinic. We're a finalist for Case Manager, External Supporter or Company of the Year. So it's all very positive, and I'm finding that through these kind of marketing streams that we're increasing engagement and increasing insight into scar management across AHPs.
Mm.
What we were hoping to do as part of our vision was to develop a course for OTs and PTs or nurses, or any professional or any individual that was interested. It could even be massage therapists. As
Mm.
a lot of the leaders in the field that have been working in scar management for a long time have that background. And to, when you see a scar, what do you do with it? What is a scar? Client or patient asks you about a scar, instead of shying away from it, be like, oh, actually, I don't know. Actually saying, hey, okay, scar, I can measure it with this scale, I can look at how immature it is, I can think about affecting this change, or even post-op thinking, oh, okay, so you're gonna have a scar following your orthopedic surgery. I'm a OT on the ward. I'm gonna just have a look and see how you're getting on with it. Check to see if there's any risk factors for excessive scarring, and if there are, do you know what? I'll ping you up an email, the NHS. That's no problem, right? I'll ask him. I'll send him a picture of the patient's consent, and we'll talk about it. We'll have a chat. We'll see. Okay, right. You've identified this as potentially going to be an issue. The patient's quite concerned, so potentially stress hormones are high,
Mm,
right? Self-perception about how a scar is going to present. Maybe they have a history of scarring, and then we're going to have a chat about it. We're going to see what we can do to actually improve that scar and keep it normotrophic, or make sure that it doesn't keep growing or doesn't stay itchy or symptomatic. And
mm.
I've had a few queries like that, and that's completely fine. I love it when people ask me about scars. Probably too passionate, but I'd rather know than not know, and then eventually get refers the client who's been struggling for a few months or a few years.
Mm.
Hope it doesn't get to that point, but hey, yeah.
And before starting your clinic, you obviously had a lot of clinical experience and knowledge already around scars. But how did you deal with learning about things like how to start the business, how to market it, all of that other stuff?
Yeah, yeah. So a lot of it is learning by doing, I'll be honest with you.
Mm,
I do have a bit of a background as a bit of an entrepreneur.
mhm,
For a few years, I've had a business where I, do kind of trading and buying and selling items and etc. So I've been always been that kind of mindset and quite interested in the business side of things. I've done a course at Birkbeck. It was a
mhm,
pioneer course where it talks about starting a new business and gives you a bit of guidance, a bit of structure, and I found that really interesting and really helpful, especially to signpost you to the correct resources that you need.
mm,
Um, but a lot of it, I'll be honest, is investing time into yourself. And while it might seem easier just to work for someone else, you have a case of pretty much there, or you'd have to build a service for someone else, and you'd lean on consultants already in that area. It's all about investing in you and your future. So I found that having a co-founder, my colleague and physiotherapist Daniel,
mm,
has really been useful to kind of share tasks, keep each other to account and on track. Because obviously we're still in full-time NHS practice now. So it's a lot of responsibility to manage both well.
yeah,
And by having someone there by my side and with me is actually quite empowering to keep going, to make sure we're hitting our goals and our milestones, and our clinic is developing. We're not just staying stagnant. But I find that it's usually work in the evenings, early mornings, weekends that keep progression alive.
yeah. Okay.
Yeah,
And where can OTs learn more about scar management?
hopefully from us in a year or so if we have this course made. But for now, I'd say journals.
Yeah.
Okay, journals are your best bet. Um, Look at anything scar related, academically or therapy related. The issue is that a lot of it is quite deeply biomechanical, looking at cells. And for me, I really struggle with absorbing that information if I can't see a practical use
Mm,
then and there. And so what I'd recommend is almost finding a scar related YouTube video as well as the journal and trying to piece both together. So one will be on silicone products, and they talk about like the difference between silicone gels, sheeting, and sprays, and then go watch a YouTube video to understand exactly what those products are, how they work, and just bring the two together. Because if you're not fortunate enough to have exposure to those products or those patients, because a lot of people aren't, or they don't think they are, but they actually have, lots of patients with scars around them, then it's hard to put it into practice and really
mm,
kind of apply and use those skills. But it depends on your learning style, right? If you're a practical learner versus a visual learner versus an auditory learner, it might just be this podcast that gets you going. I don't know, but you've got to find a way of applying what you're reading
yeah.
rather than just absorbing it like a textbook.
And some of the techniques that you use, the massage, the camouflage,
Yeah,
the compression, all of these things,
yeah.
where can OTs access some of these courses?
So for compression garments, there's quite a few
Mhm.
companies in the UK that offer it. We use Medi Garments or Dropskin. been really good with clinician education and getting the technique and the awareness out there as to the value of compression garments. Um, Scarworks massage. Again, a lot of these courses I had to self-fund because again, it was difficult to justify their value
Mm.
because again, people didn't really see the benefit to, or like the funders didn't see the benefit to kind of this as a first line intervention. And rather than do a business case, I was like, you know what, scars is my niche. I'm really interested in it. I'm going to do it myself. The same for paramedical makeup. Yeah, see if you can get a business case through because all these interventions you can justify, but again, it's another hoop you have to jump through.
Mm.
Um, and yeah, all those courses are great, but a lot of them don't really have a clinical focus or background. Like for instance, the Scarworks massage was, it can be carried out by anyone of any background, and it's usually
Mm.
taught by non-clinicians. The Scarworks massage again, typically taught by non-clinicians, but taught by massage therapists. So you've got to think about how can I clinically reason this? How can I, show that there is actual evidence behind this to improve outcomes and quality of life and improve patient satisfaction, etc.
Mm.
All these kind of KPIs that you're looking at to achieve to show that you have a good service. Um, and in terms of the silicon products, it's a bit tricky. I haven't really found a course out there, if I'm honest with you. A lot of it has been through journals and understanding the acting mechanism of silicon. I would say, as a therapist, don't do anything if you can't clinically reason it, which may
Mm.
seem like obvious advice, but if you can't justify why, how, where, what, when, then you probably shouldn't be using it because the patient doesn't know, right?
Yeah.
And if you don't know, then you keep going with silicon forever. But there is a timeline, there's a window as to when it becomes less effective. The same for the compression garments. And if you're not sound on your clinical reasoning there, your patient can't really have the same insight or knowledge as to actually, what is this actually for? When can I stop using it? Is this lifelong?
Yeah, thank you. And do you still hold a research associate role as well?
So I hold a honorary research associate role at
Hmm.
King's College London, and I was fortunate enough to be seconded to a research project that was funded by the National Institute of Health Research. It was focused primarily on the development of a prototype splint for individuals with Dupuytren's disease and epidermolysis bullosa. And so I've published a paper as a first author, so a systematic review on Dupuytren's and
Hmm.
the interventions out there. And that's more part of my hand therapy role. That it's an area that I'm interested in because Dupuytren's disease is probably a whole other podcast I could talk about, but I won't. Don't worry. And the splint is more so designed to be a device that can be used at home and patients can kind of self-monitor and self-adjust rather than coming back into clinic for readjustments and remolds, etc. So it keeps the patient empowered and it allows for remote monitoring. So you have those geographical barriers that are kind of, no more, right? If we can do a remote consultation, the patient can self-adjust the splint to increase extension of the joints, it's a win for them.
Mm.
And in terms of the epidermolysis bullosa, so I'm a clinical specialist in that area also. And so I have a clinic where I lead as an OT and hand therapist within this part of a large MDT in Rare Disease Center. That's the Thomas Hospital. Um, and I'm currently working on a co-production piece with a patient following their experiences after hand surgery. And so a part of my honorary clinical academic role, I have access to resources at King's College. So that's mentorship, peer support, and so it's very useful in terms of kind of keeping one foot in the academia. And in terms of journey, clinically and academically, it would be really important for the future generation of clinicians to be in both worlds because I think the future is clinical academics. The fact that you can really, justify your interventions, really be a leader on research, right? Because a lot of the modalities and the interventions across the NHS are years old.
Mm.
And, you know, we need to be working to the cutting edge of technology. We need to be working as efficiently as possible, especially now that we have increasing, patient complexity post-COVID. We've got increasing patient numbers, but we don't have increasing amounts of staff. And so that's led me into another area of interest, and that's more your digital transformation and innovation, right? If we can build pathways that work for patients, that reduce the amount of unneeded appointments, right? Then, surely we can have more space and more slots, more ability to treat more complex patients, right? And see patients in a more timely manner. And so I'm doing a master's in digital transformation at Hull currently. And I'm currently working on or publishing a few different projects that I've worked on within the NHS. So we're looking at patient-reported outcome measures. I'm working on another paper now where we're validating one outcome measure over an older outcome measure because it can streamline and run through a whole patient's journey from referral at GP to tertiary services, and it can kind of track from day dot as to how a patient's getting on via self-reporting. I'm also working on a project where we're visualizing all this data. So the clinical condition, all their demographics, gender, age, ethnicity, if it's reported, even borough to see if areas of deprivation have a link on outcomes to clinical condition. Putting them all together on a dashboard with outcome measures to see which patients are we serving well,
Mm-hmm.
which patients potentially could we serve, and which patients are we not engaging? What is the missing data within all of this? And then how can we form outreach to really increase our service provision to make sure these people access our service?
Mm.
So there's quite a few doors that I'm trying to work on
Yeah, I
and keep up. So it's just finding the time for it.
was
But
going to say it's amazing you found the time to do this podcast.
no, I'm more than happy to. More than happy to. Um, there were a few different take homes that I reflected on while I was kind of preparing for this podcast. Is it okay if I share
Yeah,
them for
please. Yeah.
new clinicians? Just take a note of them here. And I think okay. So my first point was that the NHS is a form of goodwill.
Uh-huh.
It's good people investing into others. So, as I mentioned at the start of the podcast, like looking after your future generations of therapists and health workers to really empower them and encourage them to be the best therapists they can be, right? So, really investing in your teaching, your clinical supervision, making sure that any students that you get through the door, rather than being, a really stressed educator, which is, a hard thing to battle at times, but really giving them the time and the access to really kind of take the most possible from their placement. And again, like huge shout out to my managers and colleagues who've always been super supportive of my ventures and my projects and push me forward rather than be like, oh, you're not sure about that one. Maybe you should focus on just doing your core clinical duties. Nobody said that to me, right? Everyone's really keen and really kind of engaging me and being a better therapist and really pushing and applying myself to different domains. And that could be through different opportunities that open up. And then I think if you put the work in, opportunities will present themselves. So doors will open. And you've got to see OT as a career, not just a job.
Mm.
Okay. And so a job is a 9 to 5, a career is weekends, evenings, mornings, right? If you're really passionate about something and you want to progress and develop, you might have to do something outside the 9 to 5. And I think that's okay. For some people, it's not them. It's okay. You've got other commitments, families, OT is more so a job than a career. But if you really want to develop and become a clinical expert in an area, you've got to put the work in. And I think when you're working on so many different projects or avenues, you've got to be really mindful about burnout.
Mm.
And again, I could talk for a while about this, and there's probably other clinicians or professionals who have studied burnout. But if you have a really strong clinical interest and a niche that you're really interested in developing, it will act as a protective mechanism against burnout because you're really engaged in it. You're super interested in developing in the field as a clinical expert in the area.
Mm.
And by actually pushing yourself and applying yourself in that area, you're making a name for yourself, right? You're getting all these questions. People are coming to you as like, you put it in the scar, like, how do I manage this? And it's really rewarding to see the impact that you're having with patients,
Mm.
clinicians, and just as a service in general. Um, and yeah, so that's what I kind of reflected on when I was putting all this together. I was like, if I could tell anything to new clinicians or even like students who are thinking about OT,
Yeah.
that's what we need to be working on. Yeah, and I would.
Great take home messages. Thank you. And just to end, what's your future plans as an OT, as a clinician for yourself and also for London Scar Therapy Clinic?
Yeah. So future plans. Again, I've mapped myself on a mirror board. So I put myself in the middle. I've put all these different doors available as areas to go through. And I'm a bit of a crux, if I'm honest with you, because I want to keep all those doors open, but I
Yeah.
know that feasibly I can't. I've got to think pragmatically, something's got to give somewhere. So I'd love to, for LST, for Lung Scar Therapy and the Scar Clinic, I'd love to develop a course
Uh-huh.
for clinicians and anyone interested in scar management who can impact their patients and really develop the field as awareness. For the whole digital transformation masters that I'm doing, I'd love to move a little bit into digital health and think about more macro initiatives as to how we could, really make the NHS more efficient and work better for patients and increase equity and service coverage. And for clinical academic side of things, I'm quite interested in research. So I'm quite interested in on studying scars
Mm.
and finding a better scar scale than the outdated Vancouver scar scale that doesn't work for your darker skin types, like I mentioned. So really looking at water loss as the primary measurable factor for immaturity. Um, and for LST again, I think as long as we keep pushing the awareness that scar management services exist, I think even publicly and privately, different GPs and case managers and professionals will seek out scar management. That'll be in the forefront of their mind and actually, okay, look, they've got a bad scar, patient's unhappy with it, let's refer on. And I think that's what the future holds. But again, ask me in a few weeks, and that might change. I might have a different plan or open up another door as to what I want to do. I can't help myself in that way. I try to rein it in, but I try.
Well, thanks ever so much for your time. It's been such an informative podcast, both in terms of your clinical knowledge, but also your drive and your motivation to follow your interests.
No, thank you for the opportunity. I'm really happy to be here.
Thank you.